Okay, here's my IV push medication return. So the first thing I'm gonna do is come into my med room here and wash my hands. I don't have hand sanitizer, so I'm gonna use this lotion. Okay. So I'm going to get my MAR and see what medication I'm getting, which is going to be Zofran, and I'm going to find it in my drug book. So I found Zofran, which is also known as ondansetron, and I'm going to find what it's used for, which it's an antiemetic, and see if it needs diluted or not, which it does not need diluted. And I'm going to check the rate of administration, which is at least 30 seconds, but given over 2 to 5 minutes is the preference, so I'm going to give it over 2 minutes. Now I can go ahead and clean my medication label, or clean my medication vial, not the label. And I'm going to clean it for 15 seconds. For the purposes of this video, it's been 15 seconds. I'm going to let this dry completely. While that's drying, I can go ahead and get my needle ready. So these would be in packages normally, so I would take them out of the package and make sure to maintain sterility with each one and put my needle on. Then I'm going to go ahead and make sure this is dry, which it is now. Take off my cap. Oh my gosh. My hands are really slippery from the lotion I used. Okay. And I'm going to take 1 milliliter of air, because my order is 2 milligrams per milliliter. I'm going to put that in my medication, insert the air, and draw up my milliliter. Now that I have my milliliter, I'm going to make sure there's no air in here. There's no air. Usually I would secure the safety here and put it in the sharps, but I'm going to recap in case I need to reuse this needle again. Then I would put this in the sharps container. So now I have my medication, and I'm going to put my blue cap on. If this was in the package, I'd take it out using sterile technique and put it on my medication. Then I can make my medication label. So I have my patient, which is John Brown. My drug, which is Zofran. The amount, which is 2 milligrams IV push. My initials, the date, which is April 5th, and the time, which is 3:30 p.m. I'm going to check the expiration of my medication. It's not expired. I'm going to write the expiration date of 2021 on here. And then I'm going to put my medication label on my medication and make sure not to cover up the tick marks. Okay. So I can go ahead and prepare my other syringes now. I have 2 flushes. I have only 1 blue cap left, so I'm going to show you that. So I would take off my cap for my flush, make sure all the air is out, which it is, and by using sterile technique, put on my cap for my first flush, and I do the same thing for my second one here, which, like I said, I really should not have used lotion. I can't get it. Okay. Okay, we're gonna say that I took this off and I'm getting all of the air out, and I'm going to attach my blue cap back on, which I don't have, but I put it on. Okay, so I have my 2 flushes, I have my medication, I have my MAR. I'm gonna take my medication into the room with me. So I'm taking all of my supplies into the room with me here. All right, so I'm going to knock on the door here. Hi John, my name's Ashley and I'm going to be your nurse today. I'm just gonna wash my hands really quick. And I just need for you to verify your name and your birthday. So I'm looking at the band. The patient has verbalized that his name is John Brown and his birthday is December 2nd, 1960. That matches my chart. And John, do you have any allergies? No, John does not have any allergies. So we're gonna go ahead and get started. Before I give John the medication, I'm just going to let the instructor know one more time that my medication is Zofran. I'm going to be giving the Zofran for nausea vomiting. It's an antiemetic. I'm going to be giving it over 2 to 5 minutes. I'm going to do 2 minutes, and it does not need to be diluted. I'm going to just double check my medication and do my 5 rights. So I'm going to check my name again here. I have John Brown, December 2nd, 1960, December 2nd, 1960. I have Zofran. This is Zofran and my Zofran bottle here. I'm giving 2 milligrams, IV push. I'm gonna be giving it now, and my bottle is not expired. And just in case I didn't say it already, I would ask John if he had any allergies, and he said he does not. Okay. So the first thing I'm gonna do is put my gloves on. And I'm going to assess the site here. So I'm just gonna look at your site, John. And the site looks clean, dry, and intact. Is there any pain or tenderness, John? John says there's no pain or tenderness in the site, and there's no redness or swelling, so we're good to use this site now. So the first thing I'm going to do is get my alcohol swab. And I'm going to clean this port that I chose for 15 seconds. It's been 15 seconds now. It's been 15 seconds now. I'm going to let this dry completely. Now that this has dried, I can go ahead, lay down, and get my flush ready. Okay, so this is part 2 of my video. So I went ahead, I scrubbed my port, and now it's dry, so it's ready for me to attach the first flush. So I'm going to attach the flush. I'm going to unclamp the port here. The port is unclamped and ready to go. I'm going to pull back to see if there is blood return. to make sure there's proper placement, which there is blood return. So we're good to go. So I'm gonna go ahead and flush 2 milliliters slowly in while I'm assessing the site. So do you feel any pain or tenderness, John? John says no. And the site looks clean, dry, and intact. Now that the first 2 milliliters have been put in, I'm going to use the pulse technique and put the rest of the flush in. John, do you feel any pain or tenderness? John says no, still assessing the site, and everything looks great. No redness, no swelling. The dressing is clean, dry, and intact. Okay, after my first flush is done, I can get my medication ready. So I'm going to get another alcohol swab, and I'm going to clean for 15 seconds the port. It's been 15 seconds now, so I'm going to let that dry completely. It's completely dry, so I'm going to go ahead and push my medication. I put this on using sterile technique again. And I'm going to push my medication over 2 minutes. So I'm going to start timing and start pushing my medication. And over this 2 minutes, I'm assessing John. John, do you have any pain or tenderness? John says no. And I'm looking at the site. The site looks clean, dry, and intact, and no redness or swelling. It's now been 2 minutes and my medication has been fully pushed in. So I'm going to get rid of that. And I'm going to clean my line for 15 seconds again. Clean my port. It's been 15 seconds. I'm going to let my port dry. It's now completely dry. I would use sterile technique to connect my last flush. And for the last flush, I need to put in the first 2 milliliters over the same rate as my medication, which was 2 minutes. So I'm going to start pushing in my flush for 2 minutes while assessing John. John, do you have any pain or tenderness? John says no. And the dressing looks clean, dry, and intact with no pain or redness. It's now been 2 minutes and that went in fine, so I'm going to use the pulse technique to put the rest of my flush in. I'm assessing John again, making sure it's clean, dry, and intact, which it is. No redness, no swelling. John, do you have pain or tenderness? No? Great. All right. I'm going to take this off, clamp my port back shut. I'm gonna just assess John one more time. Any pain or tenderness, John? John says no. I'm going to check for redness, swelling, and make sure my dressing is clean, dry, and intact, which it is. Okay, John, if you need anything, just let me know. I'm gonna throw away all of my stuff, take my gloves off, wash my hands, and leave the room. And that's it. Thank you.